I've never seen my son like that, ever. And if I'm honest, and I will be honest, I thought I'd lost him.
When he took his jacket off and I seen the injury, it was really severe, really quite severe. I've never seen anything like it myself.
Breathe in, hold it, and then nice, slowly breathe out. Is that making any difference at all? Is that helping with the pain?
No, just it hurts when I'm breathing.
It's hurting when you breathe in.
If you could score the pain out of 10, 10 being like the worst pain you've ever experienced, how would you score it at the moment?
10.
We're currently on our way to a lady who's suffering with severe abdominal pain. So he's going into her back and into her groin. Could be a multitude of different things really, anything from kidney stones to a water infection. See what the history is before we get there and see if we can help her out. So what's been going on again, remind me? I've slept since.
Keep getting this pain in my stomach.
Yeah.
My groin, my leg.
Okay.
Keep having flare-ups. I was great, I've been down the park with the kids, I've done nothing strenuous, have I? It's just come on with a vengeance.
It started off 3 years ago. And I had this really intense pain in my stomach. I thought it was appendicitis. And so did the doctors when I got to the hospital. But it wasn't. They did every test imaginable. I mean, I was in there for 4 days and they couldn't find out what it was. And after that, it seemed to be every week I was calling an ambulance with this pain. Excruciating, can't explain how bad it was.
I've been agony.
I've had 3 children and I would rather give birth 5 times than go through that pain.
And the calling spasms. Oh. It's me back.
Right.
So I've lost 2 discs in my back.
Right.
And my bones are crumbling. And it's dust. It's in the nerves.
Okay, it's all right.
Wendy's condition is chronic. All John can do is offer her different levels of pain relief.
When's the last time you had some paracetamol?
About 2:15 on its own.
Like that then. Right.
And I can't have that in here because that makes me sick.
Right. Get a cannula into her hand, give her some morphine and we'll pop up to us as well. This lady, she's known to me. No, she sounds like a long-standing history of disc problems and pain going down to her arm. She's waiting to see the pain clinic, basically long-term chronic pain relief. But it's obviously flared up today. She's done a bit of out and about, haven't you? So you've been down to the park, so... What was Neil in? Have your hand, sweetheart.
Yeah, I'm going to wait till he's got. Oh. Sorry.
That's right.
Oh, and I hate these pigeons.
You do get used to seeing people in pain. That's definitely part of the job. It's worse to deal with when you can't do anything about it. We've got quite significant painkillers we can give intravenously, but when you've given all that you can give and they're still in pain, it's quite hard to deal with, and you kind of it's just all you can offer them is sympathy, really.
This is John's 3rd visit to Wendy in the past 12 months.
Oh, can I have some water?
Okay. Get some water, chick.
I got some.
Use some grapes as well if you want.
See, I got some.
You're a fan as well.
I could do without it, but I tell you.
So when you've got somebody like John who's really friendly, it does put you at ease. I think I've seen him in the daytime, middle of the afternoon, and I've also seen him like 3, 4 o'clock in the morning, and he never seems down. He's always upbeat, always happy and smiling, you know. He's probably dead on his feet, but he still puts you at ease and does his job so professionally. He's just a nice bloke.
Shouldn't take 3 years, should it? To be paying for him.
The problem is we don't really know what's causing it, do we? No. If you know what I mean, it's...
When you don't know what's wrong with you, but you're in constant pain, you do get angry and frustrated. Think, you know, what the hell is going on? Am I going to die? And you do think they're a lot. I've had very dark days and I have cried and cried. And it's an awful thing to say to your children, but I've even said to my children, if this is the rest of my life, I don't want it.
How are you feeling now?
A bit better.
Anything kicking in? Anything make you feel funny?
Sorry?
Anything making you feel funny?
No, I'm all right, I'm just itching. Just my arm's itching.
And that's normal for you?
Yeah.
crazy. It's instant. As soon as the morphine goes in. My arm itches. Oh, it's ever such a funny sensation, that is.
That is.
Oh, you can feel it all up here.
It's a good job of it the right one then, isn't it?
18 minutes after being given the morphine, Wendy is on her way to hospital, where she will receive even stronger painkillers.
The hardest thing about being a paramedic is the suffering that you deal with. You're giving everything that you can, and if it's still not working, well then, it's get them in somewhere where you can give them something better.
I recently changed doctors, and she was marvellous and got me to see different specialists, and things started to really move then. And I had an MRI scan, and I finally had a diagnosis after 3 years. It was amazing. I've been diagnosed with disc degeneration. After the diagnosis, I went in for a procedure, which I hope has worked. I had injections in my back into my nerve endings, and I've only had the pain once since. So we might be getting there now. It feels absolutely amazing. It really does. I feel like I've got a life again, because my life was put on hold for 3 years. In those days, I just felt that life wasn't worth living. Most of the time, I was just sat in the armchair all day watching telly, and it was so depressing, so lonely. And I've got it back. I am so grateful to every paramedic I have seen. They are worth their weight in gold. They really are. If I could give them a medal, I would.
And I will argue till the cows come home that this is one of the most rewarding jobs in the world. There's the old cliche that, yeah, I'm here to help people, and I like, you know, delivering that bit of extra compassion, and I care for people. But it's also a bit of a personal challenge to work under pressure, you know, and use such a kind of unique set of skills to deliver, some cases, you know, that life-saving techniques. Hello.
She's in the loft. That's the
She's what? In the loft? What are we doing in the loft? I hope I don't have to carry her down. Now then, is it Chelsea? Yeah? Now then, how can I help you today? Talk to me, let me know what the problem is, and I can help you.
She's got pains all in her stomach and they're shooting down the legs. She was heavy bleeding yesterday with period. It was going straight through her, but...
Is it that time of the month?
Yes, but she's suffers with endometriosis.
Endometriosis is a disease where tissue that normally grows inside the womb is growing outside the womb and can cause ladies significant problems and significant amounts of pain. Pop your finger in there for me, Chelsea. So you've been sick this morning as well? Yeah. And where exactly is the pain at the moment? And if you could score the pain out of 10, 10 being like the worst pain you've ever experienced, how would you score it at the moment? Is it 10 out of 10? All right, well, we'll get that pain sorted for you shortly, OK? It's hard to see anybody in an amount of pain, but when they've got clear distress and you can see that look in their eyes, that look of help me, and you act a little bit quicker, and you always try and go the extra mile for those people that really, really want you to help them. So have you ever been to hospital before with your endometriosis pain? Yeah. Yeah, and when was the last time? Was it recent?
Been in and out the last 2 years, isn't it?
Have you really?
Yeah.
Okay, and are you seeing your gynae specialist about it? Yeah, and what have they said?
I've seen a blood specialist. Something that wasn't from my blood.
Right.
I have endometriosis and I've had it since I was 13 years old. It's something that's always there. You know when it's coming. You don't know when it's going to go or when the pain's going to stop.
When womb tissue grows outside the womb, for example in the bowel or bladder, it bleeds with menstruation. This causes pain and inflammation.
Your belly bloats and you're sick, you're passing out. It stops you from doing everyday things, especially working. You can't make it to work. I can't drive when my stomach's bad. Even moving or getting out of bed, you just can't do it.
Now then, with one finger, tell me where it hurts the most. There, OK. I'm just going to have a little press of your tummy now, all right? Any problems going to the toilet at all? No, OK, just a light press now. Just relax, OK? Is that sore? Yeah. Sore here? And when I press here, where does it hurt?
In the middle.
In the middle. Does it hurt when I let go? Or worse when I press? When I let go. I just need to lift this leg up. Can you just relax it a little minute? All right, I'll lift it up. OK, ready? So nice floppy leg. Just relax your leg, that's better. Just relax your knee, completely relax. Does that make the pain worse or better? Or just the same? Just the same.
As a paramedic, it's quite important that we not only focus on the problem that we're presented with, but we try and rule out other problems that may arise. The reason I was moving the leg around was it was one of the tests for appendicitis, and once I could rule that out, as that test was negative, it was clear that the chronic problem that she has was causing that acute flare-up of her pain and not something more sinister.
So you can get you some pain relief sorted. Have you taken any paracetamol or anything this morning? You threw it all back up. And when you take paracetamol, how many do you take? You take 2. And when you go to the hospital, what pain relief do they normally give you? Or more. OK, and does that normally help you?
Yeah, I've actually got some.
Do you? Would you like to take some of your own? That might help you, yeah? How much do you normally have? Just 1 spoon? Yeah, all right. Do you want to sit yourself up a little minute? I'll get some of this for you. All right, do you want this then? Here it comes. Ready? OK, all right. Do you want a little drink of water to flush it down? Yeah. 113. Yeah, thanks, and Amber, back up, please. So what we're doing at the moment is we've just popped a little plastic tube or a cannula into Chelsea's hand, just in case we need to give her any further pain relief. Obviously, she's taken her own pain relief, which is great, but she says that the pain gets worse on movement. So if we need to give him further medication, i.e., any paracetamol through the vein or anything like that, then we can do that much more simply now. OK, you comfortable there for a second? That's it. Negotiate the steps. All right.
Hello.
This is Chelsea. Okay, Chelsea's 18 years old, and unfortunately Chelsea suffers with endometriosis. She unfortunately this morning, about 10 o'clock, experienced this sudden onset of a very intense suprapubic abdomen pain. She is on her period at the moment, but she's experiencing a lot more heavy bleeding than normal. I think we might be better while she's moving with just pure Endometriosis. She said that works quite well. And then we'll kind of reassess and see what we want to do on the truck, if that's right with you. Yeah. And the way she can safely come down is literally by walking. There's no way that we could extricate someone through here. It's too dangerous to use the carry chair or any extrication equipment. Obviously, if the patient deteriorated or was unconscious, then it would be a different scenario. But she's going to make her way very slowly down the stairs.
Oh, we need your bum. All right, then. What was your name again? Oh, you're Chelsea. Now, you've been having the Entonox and you've had your own armour. If you had to score that out of 10, 10 being the worst, 1 being none, where would you put it at now? It's about a 5, okay.
All right, sweetheart. Is it easier with that pain relief? Yeah? You can have some morphine now, OK?
I don't remember much. I don't even remember getting to the hospital or anything. I know they put the morphine in my hand when I was in the ambulance. And that was it, and I was gone. I was out of it.
There is currently no cure for endometriosis, but there are treatments available, including surgery to remove the affected tissue.
They just said that they'd laser it away, so that was keyhole surgery. And after I had that done, everything was a lot better for about a few weeks. I went back to work for a few months and ended up in hospital again with the same pain, and they told me that it all grew back. I've tried everything now and there's nothing else that I can try. So I know that it's something I'll have forever and it won't get cured. It's just something I have to learn to deal with.
Luckily, Chelsea has a lot of support from her family and her boyfriend, Ben.
It's horrible knowing I can't really do anything about it. So any way I can help, like going to hospital appointments and that, but I look at her and I see her and I can't do anything about it, so it's upsetting to say the least.
OK, Chelsea, we'll look after you, all right? All the best. No problem, see you later.
Been to see many ladies who unfortunately suffer with this medical problem. Again, every single one that I've seen, the common factor is that they are in excruciating pain. And the only thing that I can do, is provide that really good level of pain relief to try and get that under control. I hope she'll make a good recovery. Hopefully she'll be assessed, and I know she's awaiting some scan results. So fingers crossed for her, and wish her all the best.
Right, we've got a 15-year-old with Crohn's disease, and he's got severe abdominal pain. Here we go. Hello. Straight through.
Yeah, well, there you go.
What's been going on then? Hello, young man.
Been vomiting. And he's just not well today. He said, Mum, I'm not well, I don't feel well.
I didn't feel right that day because I got out of the car and I was sweating. I just felt dizzy. I went white as a ghost. And then all of a sudden I just started being sick.
He's got Crohn's disease.
Yes.
Got it in his stomach, his large colon and his genitals.
Right.
Kyle has genital Crohn's, which makes them very deformed, very swollen, very sore for him at times to walk. It's quite severe, and having to do with the genitals is rare. It's not common.
I'm just going to do a few little observations on you. Is that okay? Yeah? Kyle, if we had a score of 1 to 10, 1 being a little pain, 10 being a massive pain, what would you put it at?
10.
So it's that bad, all right?
The pain felt like someone was just repeatedly kicking me in the stomach over and over.
I gave Kyle a drug called Entonox, which is basically gas and nitrous oxide.
You ever had any gas and air before? Entonox, yeah?
It is brilliant as a first-line pain reliever.
Is that okay? Is that okay, Mum?
Yeah, that's fine.
Okay, and then we'll get some little observations done on him. All right. Let me just get you some transport. 52, thank you. We'll have an amber response, please. He needs to go in. What was that, mate?
I'm really cold.
Oh, no, let's get you covered up a bit and then we'll do some observations on you. Has it been this bad before? It has.
Kyle was diagnosed 3 months ago after suffering for 2 years.
All right, and just have a... No, it needs to make a noise. That's it. That's the noise.
When a child is quiet, it's usually an indication that they're poorly.
Keep going with that. Might make you go a little bit light-headed, sweetheart, but it'll help with that pain, all right?
And with Kyle, he was listening and he was talking to me, but not really making conversation. But as he was taking the gas and air, he started to relax a lot more and talk to me a lot more.
You're not supposed to be bad in the school holidays. It's term time to be bad.
You only do it all day anyway.
Oh, do you? Because of your condition? Dear me. I'm just going to pop this in your ear, my love. Keep sucking on that. OK. Temperature's OK. Is it just taking the edge off it a little bit for you? Suck a bit harder. That's better. That's better. All right, it will help. All right, Mum.
Yeah.
OK.
I've never seen my son like that, ever. And if I'm honest, and I will be honest, I thought I'd lost him.
I always say, trust Mum's instinct, they know best, and she knows that Kyle's quite poorly today and she's had the good sense to ring an ambulance, so we're going to pop him up the hospital. All his ops are OK, but he's not OK, so we need to get this sorted.
The Entonox really seemed to help him and relax him. And by the time the crew got there, he was a lot more relaxed in his stance as well, you could see. You've got one of the best paramedics in the world here.
All right then. Hello.
This is Kyle, okay? All right.
Women, Kyle?
Yeah, all women, all in green. New uniform. Right, Kyle's got Crohn's disease. Mum, he's got it.
In his stomach, his large colon.
And listen to this.
And his genitals. Okay.
Right. Today, he's always in pain, right? But today he's been in a lot of pain.
Vomiting
and he's been vomiting, not while I've been here. All his obs are perfect, okay?
He's gone down to 7 stones.
Lost quite a bit of weight. Now the crew are here. We're going to go down the line and giving him some paracetamol, but in a drip.
Yeah.
Is that okay with you?
Yeah.
Yeah, as long as it gets me better, I'm happy.
That's it.
Well, let's get the pain away and then we'll get the doctors to get you better, all right?
Just pop them in. And the other one.
Quite hard on your bottom.
All right.
It was awful. Absolutely. He couldn't stand. He didn't know where to go. He was so thin. He'd lost so much weight.
A bit of a bump, okay.
Backwards, all right. Nice and steady.
Ready? Bring your feet.
At least we've got some smiles now. Smiles from Kyle's.
In Stourbridge, Kath has been giving pain relief to 15-year-old Kyle, who's in severe pain from his Crohn's disease.
Trust Mum's instinct, they know best, and she knows that Kyle's quite poorly today and she's had the good sense to ring an ambulance.
I've never seen my son like that, ever. And if I'm honest, and I will be honest, I thought I'd lost him. Today he said, Mum, I'm not well, I don't feel well.
Okay, and then we'll get some little observations done on him. All right, and just have a... No, it needs to make a noise. That's it.
Bottom.
All right.
Later, at hospital, they found the source of Kyle's pain was not his Crohn's.
And they took bloods from him. They came to us and they said, Kyle was given a tablet called azathioprine for Crohn's disease. But the trouble was, there is side effects with this drug. Now, it doesn't affect everybody, but unfortunately, Kyle was one of the people that it does affect.
When I got to the hospital, they found what was upsetting me, which was the tablets, and they gave me morphine, paracetamol and everything because I was in too much pain.
The drug that Kyle was on for Crohn's caused him to have inflammation of the pancreas. It can be fatal if it bursts. So, in one respect, I was glad Kyle collapsed because everything came to a head then.
Thank you to them for finding it, otherwise it could have been very fatal. Because as my pancreas was swelling, it could have burst, which could have killed me.
He was lucky. He was so lucky.
3 months after the incident, Kyle's back at hospital for a meeting with his consultant.
How have you been?
Could be better. All the swelling's come back, the redness, and it's weeping again, so...
Okay.
And it's hard to walk again, so
Okay.
I don't know what to do.
Have you missed school because of it?
No, I've been going to school still, but it's been hurting. I've gone home once because of it.
How about clothes?
I can't wear jeans, but I really want to. Like trackies, I can wear these because no one can see if it weeps. But I really want to try and wear jeans, but I just can't because they hurt.
What about your skin? How is that doing?
That's going bad again as well.
Yeah, he's got really bad skin in his hair at the moment.
Okay, any sores?
Yeah, quite a few down there, and it just hurts when I try and walk and things.
Kyle's symptoms are severe. He lost his appetite, and so he is not taking enough nutrients, enough calories, and what he is taking is obviously not being absorbed well.
But we was just wondering, I mean, I've looked everywhere, how rare is it, how many people have got it? No, I just don't know.
It is really rare. We hope that we will find a particular treatment that suits Kyle and brings his condition into remission, and that he will be able to do what he wants to do, that his appetite will return, and I really hope it's a matter of time.
I'm trying to help him and keep him positive. It's not going to be overnight.
No.
I wish it was.
Joanne's always said she'll make you better. He's got a great group of doctors who are helping him, and they get their heads together, and I know somewhere down the line they will sort him out.
I'm pretty confident that day will come. It might take a few more years, but at least it'll be gone. And I just wish I could just be normal like everyone else.
So, come through is a 41-year-old male who has injured his arm somehow at work, and now there is reports that he has difficulty in breathing. There could be some significant trauma if he's trapped his arm in a machine or something like that. So again, we're heading into the unknown a little bit.
Just let you know, I've had a crew come here, so I've started them running back to the show that I need to get back.
Yeah, roger that, thanks a lot. So we just got an update from the controller that there's a crew have become available, so they're going to come and back us up. That sun is really bright today. The old sunglasses are going to have to come out later, I think.
Cameron arrives at the paper factory in under 5 minutes.
Hello, mate, how are you?
Yeah.
You all right?
Wrong day.
Okay, so what do we think's happened then?
He's climbed onto a paper roll.
Yeah.
To put a label onto a larger roll.
Okay.
Slipped, fell backwards.
Yeah.
His arms under his body.
Underneath him? Okay, fine. All right, let's have a look. Hello, mate.
His name's
How are you?
Hassan.
Hassan, hello, Hassan. Need to do some very, very quick observations on you there. Can I just cut the length of this arm? Is that okay, the jumper? Yeah?
When I looked at his elbow straight away, it was obvious to me that it wasn't in the right place. He had loads of pain, and all of his muscularity around his elbow, it was all in like a spasm. You know, he was holding his elbow so tight.
So it looks like you potentially dislocated and fractured your elbow. Okay, maybe this bone here as well. All right? So what I'm going to go and do is I'm going to go and get you some gas and air, okay, some Endotox to try and take the edge of the pain away.
My role as a first responder with Hassan was to make sure that we give him good pain relief. The speed of the gas and air is one of the biggest reasons why we give people with fractures or other injuries, you know, that they're in quite a lot of distress with, we give them to them first. It acts quickly.
Have you ever had Endotox before? Or this gas and air? A long time ago. It's this, and you can control this yourself, okay? So I'm going to give this to your other hand. You simply put this in your mouth, make a tight seal around and just breathe normally, okay? When you breathe this in, I want it to make this noise, okay? It will start to work after a couple of minutes, all right? Has the pain gone away a little bit, taking the edge off?
Still the pain.
Still the pain.
When I asked for the crew to arrive, you know, they came in, they brought in the most vital piece of equipment at that job, which was the vacuum splint, something that I don't carry on my own as a responder on a car.
Everybody's in kind of 10 out of 10 pain now as soon as we go anywhere near this elbow position. And what we need to try and do is get you sat up, okay, so we can have a good look at this elbow. We want to vac splint it.
So the vacuum splint's a great piece of equipment that allows us to immobilise a limb, the whole length of a limb. Basically, it's filled with beans, and we withdraw all the air away from that mattress so that the beans become tightly compact together and allowing, you know, not allowing anyone to move the limb that it's wrapped around.
So just deep breaths, doing really well. Keep your arms still, and what it'll do is just suck the air out, okay? Might feel a little bit strange.
Okay, go like this.
Can you feel it getting tighter? Yeah? You won't be able to move your arm now, okay? It's coming out. So to stand on, you need to try and bend your knees with your feet on the floor. That's it. And we're just going to stand up. Are you ready? After 3? 1, 2, 3. Brilliant. Well done. Okay? Have a sit down on here.
And that's when he took his jacket off and I seen the injury, it was really severe, really quite severe. I've never seen anything like it myself. Yeah, I hope it's all right, that's all that counts at the end of the day, is you know, he's going to be okay. So.
All the best, Hassan, and I'll see you soon, mate. This is a label he was putting on. The label does actually tally up to the roll, so I can't see what was happening with it. And this is the roll that he fell off just here. Just over 1/2 metre in tallness. And as I say, he's come down to a very hard bloody floor. And he's done himself a nasty injury. All the best to him.
I know it sounds a crazy question. Score out of 10. Imagine 10 being the worst pain ever. What would you rate it right now? 10. Oh, I thought that's what it was.
Hassan, can I have a look at this arm? We're going to try and give you some better pain relief. Okay, just relax now. Little scratch, okay?
Intravenous paracetamol is a great drug that we can give people for significant pain. The drug gets into the system quite quickly. We're skipping the whole digestive system and we're entering the bloodstream straight away.
Hassan, good luck to you. All right, any problems? Craig's your man. All right, see you later.
Yeah, cheers.
All the best, see you later. All right, bye-bye.
It happens, we're humans, we make mistakes, we have accidents. It's just fortunate that we're there to help him out when he had his accident.
The X-ray in my elbow, and they said that my elbow dislocated, and there is a broken bones as well.
Hold it there for 30 seconds.
They had to operate my elbow and took it over 3 hours to be done. Yeah, I'm doing well now because I'm going to the physiotherapy, and he asked me to do some training for the elbow. Life is difficult when only have one arm to use. Making a cup of tea and getting dressed in the morning, that's difficult. Yeah. I'm very grateful for the work that Paramedics did for that day, and I want to say thank you. Yeah.
We're going to a 33-year-old female who has rang 111 this evening because she's got stomach pain. She's got a bit of flank pain as well. She's got a headache, and that's all we know at the minute. Evening. How's it going, bud? You all right? So, where is she? Upstairs. You all right, darling? She said it's OK. Do you want to sit up for me, darling?
Oh, please don't make me make that sit up, it hurts.
OK, that's all right if you don't want to sit up, don't worry. Right, let's have a talk about what's going on this evening, then. What's the matter?
So it started Sunday evening, just severe pain in my left side of my stomach, my rib, and that just gradually got worse.
Yeah.
I was still able to function as normal yesterday, just every now and then doubling up in pain. And then last night, I developed severe headache and back pain. Couldn't sleep at all with it all night.
OK.
And it's just got worse and worse.
I'd been feeling unwell for a number of days, but then suddenly that day it became so intense and it was hurting to breathe and hurting if I tried to walk. And I knew I needed to get medical attention.
Have you had anything else for the pain? Paracetamol?
No, just paracetamol, regular paracetamol every 4 hours, like clockwork.
OK.
The last one was 7:30.
7:30 tonight?
Yeah.
OK, so you've had some recently, haven't you? So what prompted the call? Because the pain just got too much, you
It
couldn't...
got so bad, and
OK.
my headache and my back, and she just couldn't even move.
OK.
Is it all right if I do a few obs on you? Is that OK? Are you all right to sit up, or are you more... I know
it's really painful.
You'd rather lie down there. All right, I'll see if I can get to you.
Have you done your temperature or anything like that, or is it...?
No.
OK, let's have a look. There you go. You got an infection somewhere. Do you get kidney infections a lot or urine?
I used to years ago. I haven't had a kidney infection in years.
No problems with waterworks, passing urine or anything like that?
I'm struggling to pass urine.
You are?
I've already managed to pass urine twice, but I've drunk about 12 pints of water.
Do you mind if I have a look at your tummy? Is that okay?
It's okay.
Don't worry about them. Let's have a look at your tummy. I'll come around this side. Right, show me where this pain is.
This area here.
Okay. Right.
The pain and then the back pain is
There, on your flank.
just under there, just travelling.
Okay, all right.
I was developing intense pain in the sort of mid lower back either side of my spine, just sort of underneath where your ribs end. It was very, very tense, and when I tried to take a breath in, it felt like someone was squeezing something inside of me really, really tight, which was very, very painful.
In terms of what's going on, the way you're describing the pain, you've got a bit of a temperature, you've got a headache, you don't feel like eating. It seems like maybe possibly a bit of a kidney infection you've got.
Yeah, I mean, you're showing some signs of infection, and kidney infections aren't very nice, and we don't know how long you've had it. When people get kidney infections, they can be quite painful. Sometimes they've had a water infection that's not been treated and it's just got worse. We can go to patients that have just got a bit of irritation and they're in a bit of pain, they've got a bit of back pain. And then we can go to people that are totally off their legs, they can't walk, they're confused, and it can really knock them about for a long time. I think you could probably do with some, some more tests, something that we can't do here. So, you need to see a doctor and probably get some antibiotics sorted out for you before it gets any worse. Are you happy to pop up to A&E? OK.
But before they can move her, the ambulance crew need to get Melissa's pain under control.
Have you ever had gas and air before? Yeah? You want to try some gas and air? I think we'll try some gas and air, darling. Obviously, it's not going to take the pain away, but it's going to take this edge off, so we can sort of have a proper look at you without it causing you too much pain, OK? Yeah, obviously it's difficult to see people in pain, obviously. That's something we can do something about, which is nice. But I think there's only so many clinical skills we can be taught to treat people and stuff with pain, and there's only so many drugs we can give, and if they're sort of contraindicated or we can't give them for whatever reason, that's when you draw on sort of your talking skills and your interpersonal skills, and it definitely does help.
Very painful.
In Willenhall, Tracy and Dan are treating Melissa, who's got severe abdominal pains and a suspected kidney infection.
Try some Entonox. Hopefully it'll take the edge off. All right. You've had it before, so just grip it with your teeth, and then might make you a bit dry, it might make you a bit woozy. Breathe in, that's it, breathe in, hold it, and then nice, slowly breathe out. All in one breath. Then breathe in. Try and regulate your breathing. Because I think you're anxious with the pain, aren't you? Is that making any difference at all? Is that helping with the pain?
No, just it hurts when I'm breathing.
It's hurting when you breathe in. Melissa had already taken some of her own pain relief, so it meant that we couldn't give her paracetamol. So we had to look at a bit of gas and air for her, the next best thing.
Yeah, she had some gas and air, and it wasn't...
It wasn't helping her at all, was it really? She was in quite a bit of pain. Sometimes we can only manage so much, and then further tests are need doing at the hospital, urinalysis, scans maybe, but something that we can't do, so we'll take her to hospital.
But Dan and Tracy are loath to move Melissa when she's in so much pain.
I think you need some more help to manage this pain, don't you?
Oh, OK.
Why don't you try your Oromorph?
I normally take it if, like, my jaw dislocates or something like that, or my ankle. But it's not that bad.
Okay.
Melissa is no stranger to pain, as she suffers from a rare genetic disorder that causes her joints to dislocate. When they do, she takes oral morphine or Oromorph.
The condition I suffer with is Ehlers-Danlos syndrome, It's a connective tissue disorder, so I dislocate my joints very easily, whereas normally you would need quite a lot of trauma to dislocate a joint. It's quite easy for someone with Ehlers-Danlos syndrome to dislocate one of their joints, and it also causes things like easy bleeding and easy bruising, and we just have to get regular checkups really.
You seem like you're in a lot of pain, and that internox, it's only taking the edge off, isn't it? Do you know what I mean? So do you want to try some Oromorph?
Well, I normally only take it when it's something really severe, like...
Obviously, that's where we'd go, is Oromorph. Okay?
And there's plenty in the cupboard, if that's what you think it is, but I would think it's not at the stage I would need the Oromorph just yet.
Okay. Okay, that's fine, yeah.
For me, yes, I was in a lot of pain. Nevertheless, it still wasn't as bad as some of the dislocations I've been through. I was explaining to him that I'd rather not take the Oromorph unless I absolutely had to, like with a really bad dislocation. And just because of the side effects I get from it, and because it's something I don't like taking very frequently.
With morphine not an option, Melissa will have to rely on gas and air for the trip to hospital.
Which way are you going? That way or this way?
Your slippers are down here.
Oh, are they?
All right. Do you want to grab the gas and air, Dan?
Yeah. Do you need any, darling? You want any gas and air? Yeah?
Thank you.
Let's take it slow. I'll go first. All right, darling. Sick bag's there. As I said, I know it's not the best, but obviously it's the best we got for the minute, innit? All right, okay? We'll get to New Cross. Yeah, happy, Trace? All right. As my colleague said, looking like a kidney infection. Obviously, with the kidneys, you have to be careful. We don't know how long she's had it, we don't know what's going on underneath. She's clearly in a lot of pain. She's clearly got quite a high pain threshold. But obviously, she's had the paracetamol, so we can't give her anything stronger there. And she needs a few further tests, basically, that we can't do. So we'll see what happens there. What's the matter? What's the matter, darling? What's the matter? What's the matter? Short, sharp breaths, like we said.
Okay.
Short breaths. Come on, don't get upset. How old's your son? When have you got him back?
My mum and dad picked him up from his football club and brought him home, said he'd feel well all day today, so they went to pick him up.
Oh, so they said they'd look after him. When we got onto the truck, he was still in a bit of pain, so we reverted to sort of the talking tactics and trying to calm her down a bit. It's one of the best tools that we have, I think, without even bothering to give any drugs or medicines.
All right. Tracy and Dan, the paramedics, were really good, lovely people, very patient, very calm, and I think you need that when you're in a lot of pain. It can make you a bit panicked or flustered, and you know you need someone who's staying calm. It's reassuring, and I think it's always good as well when they talk to you and try and distract you a little from your pain.
All right, here we are. Do you want to take the Endonoxin with you, or...? It's making you feel sick. Do you want to give it a break, then? We'll give it a break. Let's have these off, yeah? Now you're charged up.
Okay.
Yeah. Okay.
She seemed to have calmed down by the time we got to hospital. So she's feeling cold and trying to snuggle up, so I think there's definitely some sort of infection there. So hopefully they might, I don't know whether they'll scan her or just treat her with antibiotics and send her home. But yeah, job done.